I'm talking to Mark Broadhurst from Wyre Council. Now, Mark, you're the Director for Health and Wellbeing. So last week's reports about the cost to the NHS of lifestyle choices, and particularly the findings of Public Health England about certain parts of Fleetwood, must have rung a few alarm bells for you.
I mean, it does indeed, yes. Yeah, I mean, we're not uncommon with, many other communities across the country, particularly where there are, quite large health inequalities, quite often, income and deprivation based. So yeah, of course, alarm bells rise when Public Health England tell you a little bit about your health outcomes within your area.
Now, one bit of good news coming out of all of this is the fact that there are already things going on in Fleetwood, in Wyre and the wider community to try and persuade us to live more healthily.
There's an awful lot that ourselves are doing as a local authority. We're a vanguard area for various NHS initiatives, and we work closely with the voluntary community and faith sectors locally. And we've got a great local population, a proud population and strong population in Fleetwood, that we know that we can build, a much greater collaborative approach to the prevention agenda. And I think that's what is key, us all working together on that agenda.
Now, you mentioned you're a vanguard area for various reasons. Just explain to us what that actually means practically.
Our local clinical commissioning group, the Healthy Wyre Clinical Commissioning Group, has put forward proposals with regard to new initiatives with the way that health and social care need to be rolled out. What government were after were trailblazers for local areas to look very closely at what the health needs were of the local population and to change the way that local health services are delivered.
Now, one of those areas, one of those trailblazing activities is something I believe called Trisport.
Trisport is something that, ourselves as the local authority and working with our YMCA and Fleetwood Town Football Club as well, is rolling out. So it's key local health prevention focused activity. So it's getting additional people into sports. Sports are great. It's the physical exercise, it's the team building, it's the positive mental attitude that results from sport. So yeah, we've put a lot of effort into developing introductory sessions to a wide range of sports that that vary from your football to netball. We've got to focus on women's and children's activities, just as that little introductory taster session to hopefully spark an interest in getting involved in something else locally.
Because, Mark, it is pretty daunting, isn't it, to try out a new activity, a new sport for the first time. I've got a housemate here in Manchester who is wanting to get into sport, but is just totally taken aback by the thought that when you go for it, you'll be with people who know what they're doing.
There's such a wide variety of sports as well. I think it could be water-based, it could be ball-focused. So it's really trying to find out, what is right for you. And also as well, sport isn't for everybody. We acknowledge that, and we've got a wide range of activities that aren't just sport related for people to get involved with. So no matter what your health really, just as a couple of examples, we have really successful volunteer-led health walks for a wide range of abilities and health conditions. If people have mobility issues, we use trampers to get people out and about into the fresh air. Gardening clubs at Memorial Park, very successful. And that very much is just about taking part in basic gardening activities, meeting new people, sharing, gaining experiences, and some just come along for a cup of tea and a piece of cake and a chat. So it really is saying to people that we want to encourage people to concentrate on doing the things that keep them well and that they enjoy, rather than having the scenario sometimes happens where it's the NHS that are managing the illnesses.
And you're talking there about people just coming along for the chat and the cake, because yes, we can focus on physical health, and rightly so. It does cost immense amounts to put it right when it goes wrong, but there's also mental health, isn't there, and emotional health?
Yeah, mental health's a huge problem, particularly within Fleetwood, at its worst, combined with drug alcohol issues as well. There's a broad spectrum, isn't there, of mental health. But I think one of the big pushes that we're on is that we need to change the conversation, so as opposed to the one in the GP's surgery of the traditional approaches that the patient comes in and the GP asks, what's the matter with you? We really strongly feel that conversation needs to be switched to one which is what matters to you with regarding to your health. It's a much more different focus. It's about having community contacts. It's about doing things that make you happy, good quality parks and open spaces. So it's a very different conversation, I think.